Oh, good afternoon. We'll go ahead and get started while others are joining in. And we want to welcome you to the third in our introductory series, Journeys in Healing series, in our structural racism lecture series. And again, we're delighted to be joined by my partner at the university, Vice Provost Dr. Katrina Caldwell, as well as Kim DeAbreu from Partners in Racial Equity. And so I am going to turn it over to them. And just as a matter of context or housekeeping, for those of you who've attended our previous sessions, we will use a similar format of putting your questions in the Q&A box, preferably to the chat, and then that way we'll be able to get to and address your questions during the Q&A session. So thank you, and we'll go to the next slide.
Sure. So I'd be happy to just say a word about myself and then turn it over to Dr. Caldwell for some framing remarks. It's been my pleasure to partner with the Office of Diversity, Inclusion, and Health Equity at Johns Hopkins Health System for a number of reasons. The first of which is that my career has really been devoted to issues of diversity, equity, and inclusion, and more recently, racial equity and racial justice. And I've worked with health professions, education, higher ed institutions, nonprofits, and certainly have stepped into my work as a public health practitioner in this space in meaningful ways on behalf of leaders and communities. I'm also a leadership coach, and I think it comes in handy in this work as leaders want to step into the space of leading hard cultural change. Sometimes it helps to talk to them about stretch goals and being comfortable with being uncomfortable. And so I bring all those lenses to the work. The other reason why I'm happy to be here is because I'm a Hopkins alum, so class of somewhere in the 80s. And it's great to be able to give back and to share during this session. So this is the third in our series on addressing structural racism. We'll do a recap of some of the other sessions in a second. But as this session is focused on choice points and sharing power, I wondered if Dr. Caldwell has a perspective about ways in which this work is unfolding in the higher ed community, if she has a perspective about what choice points and sharing power she might see embedded in anti-racism work. So Katrina?
Good afternoon, everyone. And again, thank you all for welcoming me to this conversation. I will provide a disclaimer right now that my internet service is very spotty, so I hope not to go out during my remarks. But thank you, Kim and Dr. Golden, for this opportunity to share just insights. I know that the landscape at both of our institutions here in Baltimore, but higher ed in general, faced what for many folks perceived was a crisis in higher education. And that some have framed that crisis over the summer as a defining moment, a touchstone moment. They've used a foundational moment. Many folks have used the summer to note a start of something. And I want to suggest that since the founding of this nation, the issues about equity and about power, differentials, and about opportunity and disparities has been a part of our origin story as a country. And I'm excited about this opportunity because for some folks who are now in a place where they can participate fully, they're energized and excited about being a part of seeing the change that we all want to see. They saw demonstrably an act that for many people have propelled them into this space to be ready to do the thing that many folks in higher education have been talking about for decades. And that is about how do we think about power in a way that is transitional, transactional, and that is a core asset, if you will, for folks who have it, and how can they make room for folks who do not have it. Often when we think about spaces becoming more diverse, more inclusive, We often think about the folks who are minoritized or who are shut out of a system having to either fight to get in a system, to struggle against the system, to create room, to create space, to see themselves represented in our tools, to see themselves represented in our physical spaces, to see themselves represented in our curriculum in higher education, to see them represented in our practices in the medical profession. And what I'm excited about this particular conversation is we're talking about how instead of asking those folks to fight and struggle to make room, find space, we're asking individuals who already have those rooms, who own those rooms, who have access to those rooms, who have that power. We're asking them to think of ways that they can share, that they can move over sometimes, move back, step back, right? That they can speak less, where they can take up less room, where they can be, where they're willing to see their experiences less represented and not centralized in the conversations and the way we do business in higher education. And there's some great initiatives that institutions have undergone over the last couple of decades to do this work. And I'm just excited that we're having this conversation and that we're thinking more and more about what this means for our two entities. So thanks for that opportunity to open up. And I look forward to the presentation as well.
Thank you, and you'll be welcome to, and both Sharita and Katrina, you're welcome to jump in at any point if there are points that you want to underscore. I want to say there's so much about what you shared about the individual practice of noticing spaces where you might create room for others. I think what we hope to get out of this conversation was certainly introductory and sort of a one-on-one level of understanding of terminologies and places to start taking action. But I want to underscore what you just said about it's the fierce urgency of now. So how were some of the traumatic experiences of the summer? How might that be galvanized, not into just the short-term action, but in the sustainable action? So, so have been excited to be part of this conversation. So I'm curious, would love it if you would type in the chat. If you have been present for all three sessions, please type in 3 of 3. If you've been here for 2 of the 3 sessions, type in 2 of 3. If this is your first session, shout out, just as my first session. We'd love to have a sense of how this is working and, you know, how many returners, adopters do we have present with us today. So I don't know, Cherie, if there are things popping up in the chat, but feel free to interrupt me as those types, the written typed in comments come in.
Great, thanks, Kim. So yes, they're coming in via the Q&A because I think our chat box is turned off. But no, I'm seeing a lot of people who've attended all 3, a few people 2 of 3. So it's mostly 3 of 3 or 2 of 3.
Awesome. So it's great to have you back. Just a review of where we've been. So the first session focused on definitions. We talked about race as a social construct. We used the census as an example of how race in the context specifically of the US has changed since the very first census in 1790. And how social constructs are really designed with those in power, exerting that power and making decisions based on those power differentials. We talked about institutional racism. We talked about interpersonal racism and individual racism in that first conversation, and ways in which as health system employees and leaders, we might exert influence and might frankly unlearn some of the practices that we've learned throughout our careers and take meaningful action. In session 2, we talked about the historical context. So some of what Dr. Caldwell just mentioned, right? This is not, racism is not new. Since our founding, our origin story, racism has been present with us. We talked about some Hopkins specific historical context, as well as Baltimore specific context. We talked about redlining and racial segregation in neighborhoods and the impact that those disparities have really had on communities then and now. And then finally, today, we're going to talk about a path to justice. We're going to talk about allyship, not in a performative way, not in, we certainly know from the summer, I don't know about you, but my social media posts were filled with people asking the question, what might I do? And reading lists were shared and podcasts and protests were being sort of shared, protest photos were being shared. And the question is, beyond the immediate moves that one might make in allyship, what does sustained and more meaningful allyship look like? So we'll talk about that today. And then finally, we're going to talk about power, the places where we use power, the places where we share power, the ways in which we can take action meaningfully on behalf of others who are not in the spaces that we may be in. So before we do that, I'd like to remember always as we talk about anti-racism and the importance of noticing the systems around us, I invite us all to notice even the land that we stand on is occupied land and acknowledge the sacrifice that was made so that we may all be here today. So this, I'm going to share a video clip that does not have sound, so I don't want you to think that your sound isn't working. We would like to acknowledge that we are living, breathing, loving, grieving, laughing, and sharing space on unceded territory. Once honored and maintained by Indigenous tribes of America, that colonialism, imperialism have claimed for the sake of profit and gain. We acknowledge the lives lost and the displaced of a people that still live, love, breathe, grieve, laugh, and share space with us. May we recognize their story, their existence. May we commit ourselves to developing deeper partnerships that advocate for their progress and dignity as they practice their heritage and traditions on this land. And may we become better stewards of the land, waters, air, that support and nurture our existence. So in this journey of healing, we would invite you to adopt a practice that advances that commitment, that advances that action, that advances opportunities to speak on behalf of those who may not be in the rooms that you're in. So we want to start with asking you the question about allyship. So I made a reference to some ways in which allyship showed up in the immediate past of our summer. But as you think about allyship and what it means to you, we would ask that you participate in our poll. Unfortunately, you're not going to be allowed to pick more than one choice because we want a sense of which of the statements feels most salient for you. So just pick one, and then we'll see what where there's a center of gravity for this particular conversation. All right, so the poll is launched. See, Cherie will tell us when we have a critical mass of participants. All right, so we have our results. There was, I guess, a strong preference for amplify the voices of oppressed people before your own. And I'm really glad that that one had a lot of energy because, you know, as a Black woman, as a, you know, person from a Black, Indigenous, people of color background, there's also an invitation for me to think about the spaces where I might advocate for those from other oppressed backgrounds and groups, right? So there's something available for all of us in that statement. So let's take a deeper dive into the notion of allyship. I want to do just a quick review. This is going to be really fast. There are no first timers in the audience, so I don't have to spend a lot of time talking about some of our past concepts, but just as a reminder, when we're talking about racism, we think about it at 3 levels. So racism first is a hierarchy of human value based on race. It connotes a power differential and an access to resources. At the individual level, racism often shows up as belief systems based on racist ideas, belief systems, and a hierarchy or superiority based on race at the individual, and may sound like racial epithets, jokes, offensive remarks. At the interpersonal level, racism will show up as in more insidious ways. So it's the conversation that talks about who belongs here and who's qualified, right? Often those kinds of interpersonal dynamics contribute to tensions and toxicity in the workplace. And that's when Dr. Golden and Cherie and Tamla's office is called, and also Dr. Caldwell's office is called to conduct training programs to help teams work through some of those tensions. So those are ways in which racism shows up at the interpersonal level. And I would want to call out, though, the sort of the best bang for your buck in terms of anti-racism work often lies in structures. For example, this graphic talks about maybe differentials in access to technology. How does equity show up in those ways? Certainly, as we have been dealing with the global pandemic, we've heard about access to resources for some of our K through 12 students and technology bandwidth. Those differentials really were they didn't start with just not having access to broadband and Wi-Fi, right? Those differentials were had to do with parents with different level jobs. They had to do with where people live. So that's what we're talking about when we're talking about racism at the institutional and structural level. For myths, stories, and history, right? What are the assumptions that are in curricula of higher ed institutions and K through 12 institutions about what stories matter? Who are the experts in the stories? In this justice system, we don't have to call that out. Much of the impact of the murders over the summer really had to do with racism in the justice system and so on. When we talk about anti-racist, what we're talking about primarily is action. Action to dismantle policies that place power and advantage in one group and superiority and advantage in one group over another. So when we talk about racist in the context of our learning series, we're not talking about an identity. We're not talking about a person as racist. We're talking about policy and idea because it holds greater promise for action. So if indeed someone holds an idea in superiority of one race over another, then there's an opportunity for a conversation. If there's a policy that places an advantage of one group over another, there's room for action. So we support much of what Dr. Kendi's work says, which is that racist is not a fixed identity. We can be racist one minute and anti-racist the next. So take home, anti-racism is the frame in which we've been talking in this series about action, about taking action. Today we're going to talk about allyship, we're going to talk about choosing action, and we're going to talk about sharing power. In this frame, there is no neutral path. So I want to say that again. In this frame, there is no neutral path. Either you are taking an active step to dismantle racist policy, or you are allowing the default ways that that maybe we work, the default ways that our systems are structured, our practices, to continue unexamined. So I hope that this frame is an invitation to actually do something, and we'll be interested in your comments as the talk goes on. When I talk about non-optical allyship or non-performative allyship, we talk about all of these statements, by the way, that you responded to are examples of non-optical allyship. So you would not have gone wrong with any of the choices in our poll. When we talk about taking on the struggle as your own, we're talking about supporting your colleagues of color after the protest. We're talking about beyond, we're talking about December, still caring about racism, even after what took place on Memorial Day weekend. And when we're talking about transferring the benefits of your privilege to others who lack it, it means advocating in spaces where you are and they are not. So is that your patients? Is it colleagues? Is it communities where you know of evidence of racism, evidence of access to services and healthcare, et cetera? I mean, as we're thinking about the impact of COVID, the disparate impact that it has on communities of color, the spaces where those communities are not, there must be voices advocating for those communities. I know firsthand, Dr. Golden is in lots of those spaces over the last several days and beyond. It also means amplifying voices of the oppressed before your own. So we know that there's a big gap between our intention and our impact. And so this is an invitation to center the experiences of those who are impacted. It's not about acknowledgement. It's not about like some likes on your feed, on your Twitter feed. It is about amplifying the voices of others. It's about acknowledging that even though you feel pain, the conversation is not about you. It's a tough one, right? Because there's much about this work that is deeply painful, that's traumatic. If you're human, you feel and see the pain of others. And the reality is, if you're stepping into this work with allyship as your focus, then the focus must be on the other person. It means standing up even when you feel scared. In racial equity work, there is not safe space. I'll say that again. In racial equity work, there is not safe space. Allies create space for bravery, right? And often they model that space. It means owning your mistakes and decentering yourself. So your words are inherently shaped by systemic oppression. So shifting your mindset from knower to learner better enables you to own mistakes real time when they happen. I've been working with a set of leaders on really building their racial equity chops over the last several months. And one of the practices that we're engaged in is getting better real time at checking yourself when you make a mistake, and having sometimes accountability partners to call you after the meeting and say, all right, so here's what I noticed, right? Let me offer this feedback in constructive ways. And then finally, understanding that your education is up to you and no one else. So the work of learning and also unlearning is a deep personal commitment. So that was a lot. It was a lot of talky. That was sort of chock full. I want to pause and see if Katrina or Sharita have anything they want to either amplify or add.
I think it's important. I love the distinction between performative, right? And, you know, people often, you'll hear people say this quaint term that allyship is a verb, but there's different types of engagement even across the ally spectrum. So I love the ideal of giving folks a sense of that this has to feel like a shift, right? And that the shift, we've often used the language loss. It's not about loss, it's about sharing, right? And it's about access. So making oneself smaller, right? And providing space for other folks to grow and develop. And so I love that idea. I was gonna share a story later in the talk, but I'll share it here, that I had a mentor who would say to me, she was a white woman, and she would say to me, whenever I'm asked to advance in positions, I would always give them names of 3 other people who were as qualified as I was, who were people of color. And she said, it wasn't that I didn't want the opportunity, right? And I felt like I was qualified in the spaces, but I felt like I needed the competition to prove that I deserved the right to be there, right? So that's a real act of still competing, but providing that space for other people.
Ah, it's a beautiful example. I thought your point that that there are many pathways to allyship is a really valid one. One thing that some of the leaders and organizations I'm working with have struggled with is it's the notion that to be an ally is to be outside with the marching with the sign, and that that's this, you know, is that what we're talking about, right? I don't know if that is my calling to work. And the example that you gave of things that where a search for a position and you're on autopilot, right? Like, I'm in the search, doesn't matter to me who else is there, right? That's an opportunity to pause and say, wow, who else? Even the notion of sponsorship. So, you know, in other contexts, we talk about the differences between mentors and sponsors. And mentors are, you know, generally people who may be sources of wisdom throughout your career and provide guidance and advice and counsel. And sponsors are people who will speak well of you when you're not present. And, you know, I wonder, for those that are in positions to be sponsors of others, what might it look like to be intentional about speaking well of colleagues of color, colleagues from diverse backgrounds? So just a follow-on thought, please.
The last thing that I will say, and then I will definitely open up the floor, is that proximity is the other thing that I think about when I look at this list. You can't you can't substitute your own belief about what other people need and want and think and feel with what they actually think and want and need and feel. And the only way that you can really approximate that is that you got to get proximate. You have to be in relationships with folks in order for you can't just go in a room and say, okay, what do you all think? Or, you know, I saw this thing, or I heard this video and this person says this is the way to go. Now you got to get in relationship with folks in order for you to be able to approximate their needs and wants and yeah. So
that was awesome. And just one more bullet, right? These are relationship-based strategies at their core. they rely on relationship as foundational. So thank you for that.
I think I would just amplify Katrina's point in that, I think a key tenet of allyship is that the person who decides what allyship looks like to them is the person who needs the allyship. It doesn't, you can't decide how to give the allyship. So sort of to the point of relationships, you need to sort of know, what does allyship look like to that person? Or if you don't know, ask them, how is it that you need me to support you right now? And then people can articulate that. So I think just to amplify that point, that's so crucial.
I love it. And so, not having your allyship t-shirt printed, right, and worn proudly, right? It's determined by the person who actually needs the ally. Love it. So let's shift to a conversation about power. And I want to invite you to, before we even dive into some of these concepts, to start thinking about the places where you have power at the individual level, the collective level, and maybe even power at the systems level, right? Where are the places that you might exert influence even in your day-to-day work? So when we're talking about sharing power, we are talking about shifting the gaze, shifting the responsibility from those who have power to those who may not have power, and developing almost muscle memory for constantly interrupting whatever assumptions, defaults are at play in a power dynamic. So what do I mean by that? So I'll give you a couple of examples that are emerging in some of the public health and medical literature, but then some very practical examples that exist in just a workplace in general. So most recently, some of the really I would say literature in the anti-racism space is an invitation to start thinking differently about even fundamental terminology. So if right now you Googled racial health disparities, much of what would come up would be attributing those to these quote unquote societal factors. And when that broad nomenclature is used, what happens is it masks the distinctions between really what does that mean, right? Is it education? Is it economic power? Like, what are societal factors? And a couple of recent studies, their invitation is to just start a uniform practice of using race as an examination, for examination as a driver for those disparities, right? So what if instead of societal factors, race was the key word? Another example, so centering white authors' reflections on racial equity. So, one might say, well, the research is what it is. We aren't determining like who the scholarship on these topics are, right? And I think there's an invitation now, and I'd be curious definitely with Katrina's perspective on this. As I know in the higher ed space, there's lots of discussions about decolonizing curricula. It's even happening in my daughter's school, K through 12 education. But thinking differently about the 2 centuries of accomplishments by Black scholars, right? And how racism shapes those conversations. Using race explicitly in conversations, and shifting from that to talking about structural racism, really naming the system. Next, considering racism in discussions, considering discussions of racism as unproductive, emotional, and uncomfortable. How many of us have heard that, right? Like, oh no, we're doing this again. We're having a training on this again. And the shift to creating a culture that really welcomes exploring power dynamics and social identity and the difference they play, and welcoming those discussions, because guess what? Your colleagues, your patients, your leaders can show up more fully in the workplace. And if that's a desired outcome, then, and these conversations are just a pathway to those things. I'll go through these, and certainly Katrina and Sharita, please feel free to underscore anything. Notions of professionalism how they're used to stifle perspectives or conversations. So many of the organizations I'm doing work with now are talking about the unwritten rules that are present in the culture, right? Like, what is professionalism? What is politeness? What are the ways that one fits into a culture? And the shift that we're talking about in the sharing power conversation is talking about people of color not having to shoulder all the risk of speaking out, right? That in other spaces, there's an examination of what really matters in a culture, right? Like, who's defining professionalism? Who's just defining fit? In terms of patients, I'll just draw on my sort of early career as a community health educator. Many discussions I overheard about patients being demanding and non-compliant. What might it sound like if patients are newly empowered to safely report concerns about race, racism, and inequity, right? What if they get to be centered in the conversation? Cultural competency. So certainly there's been a shift in healthcare and public health to talk not just about competency, meaning that you could in some ways be an expert in someone else's culture. I think there's been a large shift away from that conversation to cultural humility. How might you be a learner about patients' backgrounds and experience? But how about this? How about a shift to structural competence and considering the ways in which the lived experiences of patients, their zip codes, right? Their urban zoning, education systems, being really conversant and capable and competent in also understanding the structures. How about communities given inequitable access to healthcare and being blamed for the harmful outcomes, to communities engaged in advocacy and solutions, right? Communities being the knowers of what's best for them rather than the health system. And then finally, thinking about some ways that people fit into organizations in sort of race neutral ways, to the ability for people to have their lived experiences and backgrounds dignified and acknowledged. So I just wanted to give these 9 examples of ways to start to think about that shift that is possible, to open up possibilities in your thinking. And before we do that, any reflections, Sharita, Katrina? Yeah.
Yeah, I mean, I think that these are all crucial. So it's really like thinking about changing your frame of reference, you know, and thinking about things. And obviously, you know, many of us on the call are engaged in healthcare in some form. And so, you know, when I think about it in the healthcare context, you know, when the disparities around COVID came about, you know, there was a lot of saying, well, golly, if people would just eat the right thing, like that's an example. But then it's like, well, you have to actually assume that they have access to healthy food to eat. So then how do we partner, you know, in terms of asking them, well, what are the barriers in your particular community to accessing healthy food? And then being able to collectively like take that information and like advocate to the state, the local or the state government. Like, you know, that's an example how we sort of move from, you know, almost like, you know, shifting our focus to well, people are acting a particular way to, well, there's a reason for that. And I have actually asked them what the reason is, and then we're going to partner on what the solutions are. So just, sort of as Katrina might give an example from higher ed, but that's sort of how, I begin to think about it. We begin to think about these things in the healthcare setting.
I also, and so that's a great point. And you think about it in higher ed, you brought up the issue of decolonizing the curricula. So I'm a little bit of a outlier in this conversation, and I have 3 degrees in English literature. And we've been talking about the canon for my whole academic career, and how do we shift the canon to be more inclusive of voices? And we know I talked a lot about that before and earlier, that lots of curricular evolution, like Africana studies and queer studies and all those things, they had to develop outside of the canon. There was no space for them in the canon. And so the decolonizing the curriculum conversation is not that the tension hasn't always been there, not that there haven't been people who've always wanted to elevate those voices, but that this new mood is to do exactly what Dr. Golden just said. It's to centralize those experiences in the curriculum, right? To say that these are as essential to a student's academic journey, experience, for lots of reasons. 1, because there are students who need to see themselves in the curriculum. 2, there are students who need to maybe not see less of themselves in the curriculum, but their academic development, growth, and ability to transition into the world we want our students to operate in, they need to see those folks in the curriculum as well and interrogate those stories and experiences. So.
Yeah, I love both of the points you made. So Sharita, you invited us to push past just the behavior that you see to interrogate root causes, right? Like what's happening here beyond what I can see, the behavior that I'm noting. And Katrina, you're making the case on a number of levels for sort of disruption of kind of the complete status quo, right? Like how are students going to see themselves in the work? Is it complete work? Is it the canon, right? Is it the definitive work and scholarship on some discipline if it doesn't include the perspective of others? So that is subversive. I really like it. All right, so let's get back to you and what you might do. So you've been wondering probably for the last however long we've been together, 45 minutes, about choice points that are available to you. So I'm going back to our allyship slide and inviting you to think about what you might do. And even as I sort of tee this up, if there are things that have already occurred to you that you might do as a result of some of these conversations, would invite you to start sharing them in the chat. We are curious about what's coming up for you. So with regard to taking on the struggle as your own, it is some of what Dr. Golden just said, being an accomplice for the fight of healthcare equity, and thinking about the places where you might do that. Transferring the benefits of your privilege to those who lack it. So social capital, right? Who's in your network? Who might be an influencer on an issue that impacts communities of color, oppressed communities? Are there connections that you can make? Are there alternatives to the status quo you might advocate for? In terms of amplifying the voices of the oppressed before your own, it could mean listening to patients that have been dismissed. How about this? Believing them when they share their stories. Acknowledging that even if you feel pain, that the conversation is not about you. So this is practicing calling in, which is those conversations that are relationship-based in nature and that invite a change in behavior often in one-on-one conversations, and calling out really invites a more public adherence to policies, norms, and practices. So are there places where you might call in or call out in more meaningful ways? Standing up even when you're scared, right? So if you've stepped in it, if you cause harm, what does it look like to own it and commit to other action? Understanding that your education is up to you and no one else. So reading the research, scholars, Indigenous scholars, other scholars of color might be on your list. So circle back to that list that came through your social media feeds on the summer. And if maybe a holiday break coming up at the end of the year, it might be an opportunity for some more exploration. So I'm curious about when you see the question, what power do you hold? I want you to think about both informal power and formal power to apply anti-racist principles. So at the individual level, is it learning more? Is it interrogating some behavioral patterns that you normally have? Maybe I'm more quiet, maybe I'm more loud, maybe I need to shift to being either more quiet or loud on behalf of issues that I care about. Maybe it's creating space for others at the interpersonal level. And at the systemic level, maybe it's advocacy, maybe it's writing to legislators about issues that you care about. Maybe it's advocating at the school level for more equity and in education and access to resources. So I hope this kind of opens up your thinking about places where you might exercise power. So would love if you have, or if you can, type in the chat what examples of power that you hold, and then we'll hear from a few of them and maybe discuss with Katrina and Sharita what we're hearing in the chat.
And all the chat is disabled, but you can go ahead and type
Oh, I'm
in the
sorry.
Q&A box. Oh, no, that's okay, Kim. Yes, if you type in the Q&A box, we'll be able to monitor those and see what people are typing in. Thank you.
Thank you. Definitely curious about your power and how you might use it.
Okay, so I do see one thing came in. So thank you, Laura Torres. Commented, calling people out when they make racist or inaccurate comments and providing them with education around why it isn't okay. Thank you.
Yeah, using your voice to call out. I like it.
So others, Tara Sanguinet, individual and interpersonal levels. Mark Sugarman, power to stop a conversation and to stand up to bad statements. Nicole Warren, yes, this is great. This is the decolonization of the curriculum. So curricular content at a programmatic level, content in classes that Nicole personally teaches. Amanda Emmert, I can change the language I use in papers and documents to be more inclusive. And then Mark Donowitz, hiring, consider independent of race disability. And then Susan Havria, speaking up when I hear racist comments, listening to our Black and Brown patients and get them the appropriate resources.
Love it. These are great ideas. Katrina and Sharita, anything you want to add as you, the spaces that you're in, maybe some examples of what you see colleagues doing differently in this space, or real promise that you have seen in some of these power dynamic?
I mean, I think it's interesting because I'm in a role where I can do a lot of influencing, but then there are times where, because I am, an African-American woman, that allyship becomes really crucial. And so, I think for me during the summer, right after the George Floyd murder and the unrest that followed, there were many people reaching out to me and my office sort of asking about, responses to seek advice and those kind of things. And I think one of the strongest examples of allyship that occurred very early on in that process, when I was on a leadership call with all the Johns Hopkins leaders. And, Kevin Sauer said, I just want to say that this is not just Sharita's problem to solve, it's all of our problems to solve in partnership, because she's a Black woman married to a Black man with a Black son. So we need to give her her space. And that was like so necessary. Number one, it sort of said to me, okay, it is okay for me to step away, take a moment and process. But then what it also did was for the other leaders, they were like, oh, like we've been reaching out wanting help, and they sort of, they stepped back from asking for help for a bit. But what was really encouraging is I started getting text messages every morning and, emails dropped, that were genuine. And I will say that has continued for months since June. And so like that is sort of how effective leadership can really not only provide allyship for an individual, but then also change all the interpersonal dynamics of an environment. And so making it clear that this is work that we're all accountable to. So, I can sort of use that as a personal example that for me was really like at the right time.
So well done, Hopkins Health System, that text Sharita. So Katrina, you want to say something? And Sharita, maybe have some more things in the chat.
Sure. So I'm a big fan of 360 reviews. I incorporate it in my own practice. I've worked at one institution where it was also a part of their performance evaluation practice. So whether I'm teaching a class, whether I'm working with a team, leading a team, or being a part of a conversation, encouraging that. So that assessment, that rigorous assessment from all the different parts of an institution with you or program that you touch. And for lots of people, we can't see our blind spots, right? Like we don't know those areas in which we could do a better job of serving as allies. And so I would encourage folks who were maybe hesitant to understand their power to ask other people, right? To open yourself up to that kind of assessment with the people who you report to, the people who report to you, the people who are your peers, your colleagues, and do your own 360, review around your own power that you occupy, and then start to think strategically how you can look at these three levels and take a step. This is the one thing that I can do, and that practice, that muscle, you'll see. If you engage in that practice, it will increase your not only your advocacy, but it also increase you serve as a role model for other people who see you doing that work.
I love it. So simply ask, right, for feedback of your peers,
Right.
the person you report to, and direct reports. Beautiful. Cherie, did you have something from the Q&A?
Yes, I wanted to bring up 3 of the other issues and then answer one of the questions that's very pertinent. So Phyllis Sharps mentioned these are other ways to share power. So from a systemic level, Phyllis has used her power as admissions chair to make favorable admissions decisions. Kelly Feely mentioned helping family members understand their own ignorance, engaging relationally. And Catherine Wilson talked about individually mentoring and strengthening trainees of color, working with trainees and staff in her department to educate our community and be advocates. And then Mark Donowitz asked a great question, and this is directed to Dr. Golden, what to do when patients make racist comments? And I'll turn that over.
Yeah, it's a good one. The whole body of work on that.
Yes, but I think this is particularly important, and thank you for that question, because this is like one of the key areas where allyship is really crucial. So, so the first thing is that just want to make everybody aware that we actually have a system-wide policy. It's called prohibiting patient discrimination against employees, but employees and trainees, students, the whole group. And so it covers the health system and the School of Medicine. And basically what that policy, says is that, we're not going to switch care providers because a patient decides they don't like someone of a particular race, religion, sexual orientation, gender identity, any protected class, with a very couple of just exceptions related to sort of sexual trauma, where we might make exceptions. But I think the real question is, so how do you handle it? Like, you're the attending and you're standing there, and you've got a Muslim medical student with you, and then the patient says, you know what, I don't want any of those terrorists taking care of me. We've had that scenario come up here at Hopkins. That's why I'm using it. And so in that moment, it's important to step up and say, excuse me, Mr. Smith, but here at Johns Hopkins Medicine, we have only the best students. They are top of the line, and this is someone that I'm going to trust in the future with my family. So help me understand what your what your issue is. And and often you find out it maybe is something that has nothing to maybe do with them being Muslim, but if it does, so usually when people are put on the spot like that, they may back down. But I think it's important, first of all, to tell the patient in front of the person who was harmed by the words that we don't tolerate that here. And this is a place that is inclusive to everyone. And if a patient really is insisting on switching a care provider, we can welcome them with legal support to be transferred elsewhere for their care. But I think that the real key point is that if standing up and providing allyship and speaking up to that particular patient in that scenario, really prevents the person who's on the receiving end from becoming a second victim. So any kinds of comments. And this is sort of the context in which we even really started thinking about the need for allyship training. We're going to be doing allyship training. We have a couple of approaches to allyship training that will start in early 2021. But that kind of scenario is, is unique in healthcare, because it's not just the interpersonal racism that you can experience, but the patient can be racist towards you. And so it's just a very unique situation in that way. So thank you for that question.
Great. So I'm looking at our time that we have left. And so I'm just wondering if Dr. Caldwell or Dr. Golden or Kim, if you had any closing remarks for us.
Yeah, so I want to first of all thank you for returning again and again for this series. I think our intention was to provide foundational concepts and language and an entry point into action that each of us might do. And I think I want to have Dr. Golden comment on this. This is intended, and Dr. Caldwell too, intended to be the beginning of a deeper dive in specific domains and content areas that will unfold in 2021. So let me, Sharita, do you want to say a bit about what's envisioned for 2021, what people can expect?
Yeah, so again, this series was sort of foundational, what are the terms, what are the things that we're talking about. We have recorded all 3 of these sessions, so they'll be available on our website. And in addition to that, I think, part of the plan is that we want to use these sessions and the information here as, future training material for our managers and other leadership and staff across Johns Hopkins Medicine and the university, because these are key concepts that, are really important to share. And so what we want to do starting in 2021 is each month, do a deeper dive into how does structural racism manifest in specific areas. So in February, we're going to be focused on healthcare. But then, we'll talk about other areas like education, housing, government, the legal system, because believe it or not, all of those things impact health. Maybe even more than maybe some of the things that happen in the hospital setting. So we think it's just really important for everyone to understand that. So that'll be our 2021 Happy New Year lunch. So
thank you all. Dr. Caldwell, anything? I know we're out of time.
No, just thank you all for joining us.
Yes.
All right. Be well, and season's greetings to everyone.
Bye-bye.